Okay, we are going to look into the practical for General Module 3. Okay, practical 3 for General Module. First image is on endometrial hyperplasia. The first abnormality that you can see is actually the uterus. This is the uterus. Okay, the uterus, right? And the whole uterus, you can actually see that the whole uterus is basically enlarged. Okay, the reason why it is enlarged because within the endometrial cavity, you can actually see there's actually growth there. Okay, so there's actually growth within the endometrial cavity. Okay, so this is a picture for endometrial hyperplasia. The next one is myocardial hypertrophy. So this is section of a heart. This is the left ventricle, and this is the right ventricle, and this is the left ventricle. And evidently, the whole heart is basically enlarged as well. Okay, the reason why it is enlarged is because this left ventricle become hypertrophied, where the wall become thickened, and because of the thickening of the wall, the lumen becomes narrow. Okay, and this usually is due to hypertension, long-standing hypertension, where left ventricles needs to work harder, causing it to become hypertrophy. The next one is metaplasia. This is actually Barrett's metaplasia from the esophagus. So this is the esophagus and this is actually the stomach. The normal epithelium for esophagus is whitish because it is composed of squamous epithelium, while the glandular epithelium in the stomach is reddish. This is the glandular epithelium, right? And you can actually see here, this area becomes changed. Okay, it's supposed to be similar to squamous epithelium here, but it is now similar to the mucosa of the stomach. And the reason why, because this area become glandular epithelium. Okay, so this is actually the metaplasia. Normal epithelium, metaplastic epithelium. The next one is on leiomyoma, an example of benign tumor. From here itself, you can actually see this is a benign tumor because, number one, you can see that the tumor is well demarcated. Okay. Apart from that, you can actually see there's actually capsule. It is well capsulated. And when we cut the tumor, you can see the cut surface is homogeneous. Okay. The counterpart of it is actually malignant tumor, as this is actually you need to take the image from the pot that is given to you in the lab later. So also in the pot, you can actually look for this tumor in the pot of breast cancer, and you can actually see the features of malignancy here. Number one, compared to the benign one, it is not well demarcated, and at the same time, because it's not well demarcated, it does not have any capsule. The cut surface also becomes so heterogeneous. Why it is heterogeneous? Because you can actually see areas of hemorrhage, and also the yellowish one, areas of necrosis. Okay, so this is all features of malignancy that you can see in this breast cancer that you need to take the image at the pot at the front of your lab. Next, we'll go into the virtual microscopy. Please make sure that you open the virtual microscopy and don't take the images that's shown in this video. The first image, when you click it, you will see this low power image of the endometrial tissue, and this endometrial tissue is abnormal because you can see there's a lot of glands. So there's increase in the glands number. And why the glands number is increased? Basically, you can actually see that there's increase in cell number. So that's the reason why this is actually hyperplasia. Okay. A typical features of hyperplastic gland is you can actually see that the glands is arranged very close to one another, and this is what we call as back to back arrangement. And because of the back to back arrangement, in normal glandular epithelium, you should be able to see some spaces, and this is what we call as stroma. And the stroma place spaces in hypoplastic gland. So as shown here and here, the stroma spaces become reduced, or what we call as interglandular stromal space. Okay. Next, we are going to look into myocardial hypertrophy. When you click the link, you will be you open this page, and please click on continue as guest here. Okay, and you'll be able to open this slide. After that, zoom into this area here. Okay, and here you can actually see the myocardium, which is abnormal. Number one, the nucleus should be as small as this in normal instances, or this size, but in this area you can see the size of the nuclei is increased in size. Not only the nuclei is increased in size, the cell itself, the whole cell become increased in size because of the increase in the cytoplasm volume. And this is a feature of hypertrophy. Okay. The next virtual slide is on metaplasia. When you click the link, it will open like this. There will be many fragments. Focus on this fragment only, the third fragment from the top, and you can actually see the changes of squamous epithelium. This is squamous epithelium that change into glandular epithelium. So when it changes, we call it metaplasia. Apart from that, the glands has this bluish or whitish spaces inside the cytoplasm, right? And this is what we call as goblet cells. Another name that we usually use for this is what we call as intestinal metaplasia, because the goblet cells are usually seen in the normal intestine epithelium, also a glandular epithelium. So this is actually features of metaplasia in Barrett's esophagus. Next is benign tumor, right? So you can already see there's a tumor there. This is actually the normal smooth muscle cell of the uterus, and you can actually compare. This is the smooth muscle, normal smooth muscle tissue, and this is the tumor. It almost looks the same, and that's the reason why it is well differentiated. Another feature of benign tumor. And this tumor are of spindle, and this is also spindle cells. So basically, it is actually proliferation of spindle cells. Okay, and most importantly, you can actually see the cells has no features of malignancy, meaning that it does not have any pleomorphism, no hyperchromatism, no increase in C ratio, and there will be no mitosis as well. Okay, so these are all features of benign tumor. The next image is malignant tumor. So you can actually see this is actually a tumor, invasive, because it has this large tumor and there's a lot of this small tumor that sits within the stromal tissue. Okay, and apart from the large tumor, you can actually this area become dead, and this area are basically necrosis. Necrosis, a feature of anaplasia as shown before. And when you look into the cells, you can see all the changes of anaplasia. First, the cells are variable in size and shape. That's what we call as pleomorphism. Okay, and the cells become so dark, we call it hyperchromatism. Some of the cells become so large, does not have any cytoplasm anymore. That's what we call as increased nuclear cytoplasmic ratio. And here, right, as well as here and here, you can see mitosis. Okay, so this is all features of anaplasia, or features of malignancy. Okay, that's all. Thank you.